Yes, you can buy a hearing aid from the privacy of your own home via TV, online, and yes, you can still do it the old-fashioned way by visiting a hearing center. But once you put the device actually into your ear, all too often the seller doesn't want to hear from you again. Or if it doesn't fit, or if it doesn't work right. Is there a way to make sure your concerns will get a fair hearing? Dr. Burt Brown and Dr. Stephanie Rosenblum are here to aid us. Dr. Rosenblum is a doctor of audiology, and Dr. Brown is an ear, nose, and throat doctor, and both are from Physician Hearing Centers. So welcome back to the show.
Thank you.
I guess it sounds like there's no avoiding it. Before you get into a hearing aid, you really need the evaluations, right?
Yep.
Yeah, you do. And it's important, I think it's actually probably best to go to even an ear, nose, and throat doctor because first of all, I have to determine sometimes what people are calling hearing loss, it's actually not hearing loss per se. They're just having difficulties in situations. I'm going to also examine the ear. Sometimes I'll identify a hearing problem that I can fix right then and there.
Oh.
And then sometimes I look and I agree with them there's a hearing problem and their ear exam is normal, and then it's at that point that Stephanie and I will talk, and then I'll refer them over to Dr. Rosenblum for her evaluation.
Right.
Okay, and then you step in and you do?
We do the comprehensive hearing test. So we do a full assessment to make sure that we have a full understanding of what's going on with the hearing. And we have doctors of audiology on our staff, so we're not just bringing the hearing component, but a little bit of the medical as well. And that's where the partnership really works between the ENT and the doctors of audiology.
Sounds very important. So now we know that there's a hearing loss and to some degree what that is. Can you just go out and buy your hearing aid?
No, and that's one of the misconceptions. There's many kinds of different hearing aids now, and so the other step we take besides the medical and physical evaluation is just talking to the patient, identifying what situations are you having difficulty hearing in, what's your lifestyle, what kind of needs are you going to have by this hearing aid, what do you want corrected, and when you put all that together, that's when that helps you to define what kind of hearing aid. And again, once again, in our partnership, Stephanie or Dr. Rosenblum is our expert, and she can tell you more about the hearing aids.
Okay, we've got some here out on the table as display. They're much smaller than I thought, so tell me
they're
about
actually
them.
quite small. We really want to make sure that we're fitting a patient's needs, what they want as far as appearance. So fortunately, we have a lot of smaller hearing aids these days that are very cosmetically appealing. Some are custom that fit completely in the ear, as close to being down by the eardrum. And it's amazing how we can jam-pack this amazing, sophisticated technology into such a small space. It really is amazing. And so we have the in the ear, and then we also have more behind the ear models as well, which are also very cosmetically appealing. And Dr. Brown actually has one in his ear right now.
No
that
kidding.
That you would never even know.
I would never
And
know,
everyone
you're
thinks
right.
of those hearing aids. So actually, if you see, this has been sitting in my ear, and you can actually see that hearing aid is also not very visible when you have it
No,
in
not at
properly.
all, not at all. So let's say we choose this one. You know, that's the one I like.
Okay.
So what happens at that point?
Well, we have to make sure we take impressions and customize it to you. One hearing aid doesn't fit everybody. So, you know, we make sure that it fits your hearing loss appropriately, but also your ear as well. And we also take into consideration the finger dexterity, visual acuity, to make sure that we can handle all of the, you know, what's involved with that hearing aid. So that's usually the next step.
Okay, and you've got a free program coming up, I understand, that will explain a lot more detail.
Absolutely.
So, tell us about that.
Well, what we're going to do is a seminar in our office. We're doing that November 8th from 9 a.m. to 2 p.m. And what we're going to do is give a little talks on what hearing aids about, some of the things we talked about today, show people the hearing aids, and show them how our team approach with Dr. Rosenblum and myself work, and also our special sound experience room, where we really fit those hearing aids precisely.
Really tweak it down to
We
the
are. We're really
Absolutely.
looking forward to having people come and see how we work.
All right, sounds good. When choosing a hearing aid, you want to make sure it fits your style and your life. And the best way is to try it out for a while or go to the seminar, attend Dr. Brown's seminar, see how it really works.
Find out more by calling the Physician Hearing Centers or visit their website, www.physicianhearingcenters.com. Next, Inside Outpatient Therapy.